And we are back for another episode of Alfacast. My name's Mike Winter, and I'm here as always with Dr. Bear Paul Lando up on the Smith River in the beautiful state of Jefferson, here on the border of California and Oregon. Today we have an amazing show with a guest that I've been really looking forward to, David Crowe from the Infectious Myth podcast. The world is now under the delusion of a deadly new virus that has emerged from wild bats in China. To date, the purification and the characterization of the alleged RNA identifier for COVID-19 is embarrassingly flawed, replete with false positives, and circumstantial at best. David Crowe is the host of the Infectious Myth, and his paper, Flaws in Coronavirus Pandemic Theory, is a timely must-read. David will be discussing problems with testing for COVID-19 and why we can't necessarily believe what we hear when it comes to statistics on the situation with coronavirus. David has emerged as one of the most influential voices in uncovering the truth behind current pandemic fears through his brilliant research and insightful writing. As usual, our discussion will be an open-ended Alfacast fashion and not to be missed. How's it going today, guys? How are you today, David?
Very good, thank you.
And you, Dr. Lando?
And I'm doing well. I'm doing well also, Michael. David, thanks so much for being with us. You know, your work is phenomenal and of course so timely with what's going on in the world today. And I'm really looking forward to this. You know, as you're aware, probably we've had a number of guests talking about the whole viral situation and contagions in general. I, of course, also have my own opinions on it based on my experience. And what we really want to do for our audience is just give a nice, well-rounded approach so that people can make up their own minds. And I believe from some of your amazing work that I've read and listened to that we have a lot in common. We might have some things, where we slightly differ, but that's okay because I think what we all agree with is that there's more to the story and we just want to get the truth out. So thanks so much for being with us. And I know we don't have a lot of time today, so I'd really like to follow your lead and maybe anything recent that you think is more important that we need to hear about, or certain things that aren't being discussed in the public dialogue. Just feel free to take it wherever you want. And thank you again.
Yes, well, if I can start, I think my training for coronavirus was the SARS epidemic in 2003. SARS is also supposedly a coronavirus. And, I've started writing a book, and my chapter on SARS was pretty complete, but, it just wasn't going anywhere. But when this coronavirus thing happened, I dragged my chapter out of storage and updated and got it almost to the point of completion. But some of the things I found were that the SARS virus had never been purified, that it wasn't really transmissible. The best example of that is a rather humorous accidental experiment that was performed in China, where they had a floor of a hospital which was half full of AIDS patients. They needed space, so they filled it up with SARS patients. So you have what was seen as the most infectious virus known to man at that time on one half of the floor, and you have immunosuppressed people on the other side, not just HIV positive, but people actually experiencing immune suppression. There was free airflow between the two halves. The patients could mingle. One AIDS patient was accidentally roomed with SARS patients. And at the end, there were 0 AIDS patients who became infected. The other thing that I noted was that there were some quite dangerous and ineffective treatments that were used very consistently. And those included high-dose corticosteroids, an antiviral drug named ribavirin. And if anybody knows AIDS, ribavirin is quite similar to AZT, the ferocious drug of the 1980s, and intubation. For example, there was a study in Hong Kong that compared one hospital that didn't like intubation, they only did it when necessary, versus 13 that used intubation right off the bat. for every SARS patient. And the death rate was 4 times higher in those 13 hospitals. They said, well, maybe this one hospital didn't have very serious SARS patients, but they actually found out it had more serious. They analyzed the benefits of corticosteroids, and they found no benefits, and things like bone depletion to the point where people needed hip replacements, et cetera, and also neurological damage, permanent neurological damage. And then with ribavirin, they found a higher death rate, liver damage, hemolytic anemia. So all in all, what we found, or what I found, was that there was no proof there was a virus. There were treatments that were given to almost everybody that were dangerous or deadly, and the evidence for transmission was not there. So the whole thing fell apart. There really wasn't anything left after that. So it's like SARS was created out of whole cloth. There was nothing there. People panicked, and they imagined that they had an epidemic on their hands. And of course, along with that, you have a test, and if the test is positive, then you say this person's infected. And so with coronavirus, it's just SARS on a much, much grander scale. And also, although SARS had kind of a safety valve in the definition where the spread of the disease was self-limiting by definition, the coronavirus, they decided to take that out. So as long as you continue testing on a flawed test, which produces false positives, you will never stop getting cases. You could test 10 years from now, you would still have positives.
Yeah, and then it also brings up the whole subject of what exactly is a virus. I do believe there are certain things that act like virus. It's too much of a discussion to get into here, and we've done it a lot on our other podcasts and with Andrew Kaufman when we talk about exosomes, and I share my experience as far as cell fragments and how they operate in similar fashion and actually are part of nature's process as far as helping clean up the body. So, I became a little suspect of the whole virus explanation a long time ago because I practiced differently. I learned from different people along the way that were prominent virologists and had different ideas. And then when I employed different types of techniques in bioterrain medicine to people, especially with AIDS, I mean, I can't tell you, we had many AIDS patients over the years and other kind of viral conditions, Hep C and so forth. And when, we treated them differently, tested in different ways to discover certain things that were really going on, we found that, wow, it doesn't at all fit the narrative of what we're telling people. And in addition to the fact that people get better, when you just don't fall into that, whole viral explanation and start taking all the meds that are, recommended when you're diagnosed with such a condition.
Yeah, I mean, with AIDS, it was definitely a terrain problem for many people. A lot of people connected early AIDS cases amongst gay men to the use of poppers, a carcinogenic and immunosuppressive drug. It was, a sort of it was a recreational drug that had sexual purposes, quite dangerous. And some people were very heavy users, and those were, in many cases, the ones who got AIDS. And so it was as much stopping damaging the terrain, as it was anything else, right? You had to stop the damage you were doing. And then, of course, you've damaged your body, you need to rebuild it. And that's where you would come in. I'm not an expert on treatment. One of the important things about viruses, you talked about viruses, is that, for example, in the first paper on, Chinese paper on this supposedly new coronavirus, they found, a 30,000 base RNA strand, and then they had some pictures of particles. And the important point is that those pictures of particles are completely unrelated to anything else in the paper. There is no proof that those particles contain the RNA. You cannot look at an electron micrograph and say, oh, I can see the 30,000 base RNA. You don't even know if those particles have RNA in them, let alone the RNA you're looking for. And there's only one way to prove that that 30,000 strand RNA is in a viral particle, and that's to purify it. First you purify it, then you break it down so you end up with proteins and RNA, and then you sequence the RNA, and if it's the same 30,000 bases, then you've proven that the virus contains that. So although I think the exosome theory is very important in that it explains what these particles might be, you know, if not viruses, what else could they be? Well, they could be exosomes. That doesn't necessarily mean that those exosomes contain the RNA we're looking for. The RNA could very well be endogenous, produced by our own body. You know, and there's some of the correlations between testing positive are things like air pollution, right? Like Wuhan, Northern Italy, London, England, New York. These are places with high levels of particulate air pollution, nitrogen oxide, all those other air pollutants. And there's a correlation between testing positive and also dying. So you have people who've had their lungs damaged for many years. As you probably know, the people who died generally had multiple pre-existing health conditions and were very elderly. And they were treated, I think, quite abusively. Like in New York City, in one study, of those over 65 who were intubated, 97% died. Chinese published the same number, 97%, like 31 out of 32 or something, died when intubated. And even for younger people, it was still 76%. So basically all this furor at the beginning of we need more ventilators. You know, the ventilators are life-saving. It was the complete opposite of the truth. The truth was the ventilators were killing people. But that's not all. They were also putting a lot of these elderly, frail people on antiviral drugs, corticosteroids, antibiotics, even though they thought this was a viral infection, and you know, throwing whatever experimental drugs at them they felt like. So whether it was remdesivir or they were using some arthritis drugs or chloroquine or hydroxychloroquine. And I know there's a big dispute over hydroxychloroquine, but it's still, for elderly people, you know, it's not clear that they need drugs to get out of the situation they're in. They might need some TLC. That might be way more effective than anything else that they're getting.
Not to mention,
yeah,
too,
and everything. Go ahead, Mike.
I was just going to say, not to mention, too, hospitals aren't really the most TLC friendly places. So when you go into them, you know, they're very sterile, especially now with wiping down everything. Psychologically, as soon as you enter a hospital, for me, there's a feeling of dread. So,
yes.
You know, that's something that really needs to be considered, is the psychological aspect. But anyways, go ahead, Bear. What were you going to say?
No, I was just going to make a quick comment that, you know, everything you described, David, as far as the protocols within the hospital, if I took similar measures on my crops outside on our farm here, I'd kill every frickin' plant in the whole place.
Yes.
You know, so, and that's the thing that, you know, medics just don't get, is an ecosystem as an ecosystem. And, you know, before I went into alternative medicine, I did work in emergency medicine. And, you know, and during my internship, I had to spend a few months with a respiratory therapist and go around and intubate, you know, the great numbers of people every single day. And if anybody has ever seen somebody intubated, it's it's very harsh. And, you know, and it's not going to help your health one bit. And if you're already on the ropes and frail to begin with, it's very likely going to increase your mortality incidence greatly.
Totally agreed. I mean, I spent some time studying intubation, and I consulted with an emergency room MD, a former emergency room MD in New York, Dr. Khan. And, you know, I hadn't realized that they had to paralyze the patient as well as sedate the patient, because you can't stick a tube down a living human being without them fighting back. And I found a couple of papers that described the interviewed people who survived intubation, and some of them described this nightmare state. It was like the locked-in syndrome. Their body is fighting this tube down the throat. They're awake, but they're so heavily sedated, nobody knows they're awake. And for days or weeks, they're just lying there in this nightmare.
Oh my God.
It almost made me sick to think of what these people had gone through. I mean, you've got to have PTSD after that, right? Like you would be.
Yeah. Well, if you really understand what's happening, it's like being suffocated. It's very akin to waterboarding, I think. You can't breathe on your own. You have this thing shoved down there. I mean, it's torture.
Yes, it is.
Now, in emergency medicine, it has its place if somebody's, already passed out and you just need to, patent an airway and keep their vitals going. But other than that, forget it.
Yes.
Sorry.
My most recent, I have an article which I don't think is being published yet. It was supposed to be published by a website that seems to be sitting on it, so I might just publish it myself. But I said that probably the biggest cause of death was banning of visitors from nursing homes. That it did exactly the opposite of what was intended. Many people think, we didn't lock down nursing homes soon enough, and that caused infections. Well, I think there's no virus. There's just people testing positive. And also in nursing homes, there's lots of people presumptively given a COVID diagnosis, recorded as a COVID death, who've never been tested. So the statistics are total garbage coming out of the nursing homes. But when you withdraw the visitors, it causes a cascading effect. First of all, directly, the visitors provide social interactions for these old people. It gives the old people something to live for. They can see their daughter, their grandchildren, their son, maybe some friends, and it gives them something to look forward to. The visitors also take a load off the staff, right? They will feed their relatives. They will get them dressed and out of bed, and they will brush their hair and, do a lot of things that the nursing staff would otherwise have to do. So the nursing, I shouldn't call it nursing staff, because in nursing homes, the vast majority are not nurses, and in many cases, they're not really trained at all. The staff now were faced with no assistance from visitors, quarantined staff members to reduce the load, and staff members who just up and quit because they were so scared of being infected and dying, even though the risk for healthy young person of dying, even if the coronavirus existed, is essentially zero. So now you've got lower staff levels, and that is ripe for neglect and abuse and unsanitary practices. In Canada, in 5 nursing homes, the government asked the Army to go in to give assistance, and they wrote a report that is definitely worth reading. Got leaked to the public. But they noted things like catheters being left in for 3 weeks. A man left in his bed for 3 weeks. Somebody being fed food through a tube and the food had curdled, it being left so long. Diapers unchanged, people not washed for a long time, not receiving regular food, being left, if somebody falls asleep with food in their mouth and being left to sleep with food in their mouth. It was plus abuse of the staff, right? Like roughly pushing these old people around, hurrying them up, if you want to get them changed or something like that. So you have to say that is going to cause a lot of deaths. And then in many countries, they did not want nursing home patients in ICUs. They were very reluctant to transfer them because of what they considered to be the risk of infection. And in Spain, it was kind of official policy that you do not send nursing home patients to ICU. So what do you do with a nursing home patient who has something simple like an infected wound that's getting worse, right? You need to go to the hospital to get it cleaned out, some antibiotics, new bandages, et cetera, et cetera. So what the Spanish Palliative Care Society said was you put these people on palliative sedation. I think you start with haloperidol, some cases morphine, haloperidol. And as their pain increases, because they're not getting treated for their health condition, you increase the dose. And I mean, at some point, the person is just put to sleep. And I think this is really the cause. In every country, like in Spain, when they went into nursing homes at the beginning of the epidemic, they found dead people lying in bed. They found people lying in bed who obviously hadn't been looked after for days. Italy, the similar thing. And so I think we created a disaster of nursing homes. Nursing homes had a bad reputation for a long time, justifiably earned. But if you have no oversight and no social connections, people are going to die. And whether it's they're dying of loneliness, they're sedated to death, they're just not looked after, basic sanitation is not used, and they die of an infected wound or something that's just not being looked after. It's horrifying.
Yeah, I would say the whole COVID thing is just where the lens is pointing the lens to all the broken systems in our society that are really remnant, that are really coming from allopathic models of treating the symptoms and not the cause. And we see it it really goes all the way up to corruption and everything in our society, but it's really magnifying. And what those that are proponents of pushing the narrative of COVID are really good at pointing that lens where they need to amplify, just like the PCR test does, right? Amplifying specific symptoms and effects to then point to the cause of a contagion. When it's really a brilliant ploy. And I mean, quite personally, I believe the germ theorists have painted themselves in a corner here, David, because if you extrapolate where we're going with this, with sports, with the NFL now talking about bubbles and the players being in bubbles, I mean, how are kids going to play sports moving forward? I mean, going back to school, parents are really concerned about this, with the social distancing, the masks, etc. I mean, where are we going with this? I mean, it's really kind of man's ego trying to conquer nature here. And I really feel like germ theorists, this is going to finally backfire in them, because it seems like if you extrapolate this out, the answer is the vaccine. And we've seen right now we know about vaccines, but even like so let's say you believe in vaccines, look at what's happening right now with the trials of these vaccines. I mean, it's nightmarish. I mean,
there's no guarantee that a vaccine will work, even if the standard for approving it is highly flawed, as they all are. I mean, HIV is a good example. In 1984, when there was a press conference announcing that HIV was the cause of AIDS prior to any science being published, the head of Health and Human Services, I forget what her name was, she said, we expect to have a vaccine in 2 years, or maybe it was Robert Gallo. And there's been over 100 vaccine trials for HIV, and there's no vaccine. So this idea that we can produce a vaccine by September is just a dream. I read somewhere by some mainstream vaccine scientists who said, the average time to develop a vaccine is 10 years, and about 90% of them don't ever get marketed. So, even though we have way more vaccines than we need, that is only the tip of the iceberg compared to what people, tried to develop.
And notables such as Bill Gates that are in on the so-called vaccine development are already requesting indemnification for whatever they come up with.
Well, I mean, everybody has indemnification for vaccines, right? I mean, if you want to sue anybody, you sue the U.S. government, because the U.S. government has taken over responsibility, in the 1980s, and that's, basically led to a free-for-all, because, I don't think the drug companies go into it. I mean, I'm not a total cynic. I don't think people in drug companies go in and let's create a dangerous vaccine and we'll kill people. I think they go in and they'll say, we'll do the best we can, but it encourages sloppiness, right? It's like somebody who knows that their boss is not paying attention, right? They don't really tend to be sloppy, but over time their standards slip because there's nobody telling them, you can't do this. You need to clean this up. You need to fix this. You need to do this, right? There's
Well, and
nobody.
you have board members for profit too. So I mean,
Mhm.
it's a profit model, not a health model. So that's
Yeah. That's basically profit is number one. Um,
You
and
well,
also have a great deal of compartmentalization with all the researchers and the biologists that are working on these things. So they'll be working on some little component of a project and not even know that that's going to be part of a vaccine someday. And another whole story. But there are several hundred researchers worldwide over the past couple decades that all discovered that their work was being put into effect in something that they were unaware of and was actually very dangerous. And when they tried to blow the whistle, they had accidents, we'll say. Sorry, I cut you off there, David.
no, I think that the science, the reductionist approach to science, also has led to this kind of reductionist approach to project management, right? Like you have somebody who's working on one component that can be used in multiple vaccines, right? And they really have no idea what this will be used in. So they have really no awareness of the overall product. So there's a relatively small number of people who really understand what the whole product, the completed vaccine, will do and what the dangers to that are. I think one of the problems, I spent a lot of time studying the PCR test at the beginning. I actually went as far as interviewing Professor Stephen Buston, who's one of the world experts on PCR quality control, and finding numerous problems with the tests, such as the tests are looking for different things. Some are looking harder than others, and you just can't assume the results, the positive, negative results you get from different tests are meaningful. Plus the obvious problems with the PCR tests, like people who test positive and then negative and then positive, and does that mean they were infected yesterday and today they're not infected and tomorrow they're infected again, but they're in a hospital in isolation? Like, where'd they get infected from, right? There's numerous examples of this. But the antibody tests also have their own problems. Like, antibody tests theoretically should sum up everybody who's been infected. So let's say January is the start. So if you do antibody tests in May, that should be everybody who was ever infected in January, February, March, April, May, except people who have a current infection who haven't developed antibodies. And the PCR test is the people who are infected today. And yet the number of people who test positive on the PCR test is generally considerably higher than those who test positive on the antibody test. Like, the numbers just don't add up. And their belief in the antibody test, which has never been proven to actually be associated with a virus, is so great that they're saying, doesn't look like we have herd immunity. We only have 2 or 3 or 4 or 5% of people testing antibody positive. There's no evidence that having antibodies stops you from getting whatever this disease is, stops you from getting the RNA. And there's no proof that not having antibodies allows you to become RNA positive or allows you to have the supposed COVID disease. So the antibody testing is really not panning out the way that they want it. And just like with the RNA tests, the FDA said, we're going to give you emergency authorization. You file some paperwork. If the paperwork looks half decent, your test is approved. So there's really no validation of all these tests. For example, there's no cross-validation. You've got 33 or something FDA-approved RNA tests. Has anybody ever, tested 100 samples on all 33 to see if they get the same results? Wow. Like, it would be all over the map.
Yeah, that is wild. And going back to the vaccine thing real quick, what's the other variable in terms of people being sick? We know in China they have mandated vaccines. We know Italy highly vaccinated. So it's another self-fulfilling prophecy there in terms of the vaccine creating the toxicity that then creates the illness. Just like with AIDS, with the the Hep B vaccine in 1978, where there's a lot of connections there with that.
Yes, there's generally a lot of environmental connections. And air quality is definitely one of them. Like, I think that the reason people are testing positive in prisons is probably because of the poor air quality and the fact that people in prisons are indoor far too much of the day, right? Some as much as 23 hours a day. And even when they go outside, it's not exactly fresh air with grass and trees. It's like a yard full of gravel or something. I'm interested in the meatpacking plants because, you know, I'm not sure if there are air quality challenges in meatpacking plants, but there may well be. But it's interesting that in these places, people are testing positive, but there's very few people who are sick, because generally the population of prisons and meatpacking plants is younger, and it's not in the zone of 70, 80, 90. And they're not generally people with multiple pre-existing health conditions. Like, you're not going to be working in a meatpacking plant if you have kidney disease and diabetes and heart disease, right? You couldn't take it. There are people in prisons, of course, who have, you know, it's an aging population. There are some, but most of them are probably fairly young and robust. So not at danger.
Yeah. So another thing that's come to light, or just say into the discussion, and I believe I heard in one of your interviews you were ambivalent about it, maybe, but tell us, does the role of 5G or all the microwave, you know,
Well,
we have to bring it up because it's such a big thing, and you may not necessarily believe in that.
Yes, I have to confess that my day job is as a wireless consultant. So I have a conflict of interest in that, you know, my income has come from wireless systems since the 1980s. On the other hand,
I didn't know that.
Yeah, no, I think it's important that everybody knows that. On the other hand, I do know a little bit, and it's not clear what people mean when they mean 5G. Like, 5G involves a somewhat new modulation system. It's not dramatically different from 4G. It does involve higher frequencies, and they are, in theory, talking about going up to 60 gigahertz, which is the frequency that interferes with oxygen. But it's highly unlikely that 60 gigahertz would be used in your phone because the signal weakens so quickly through the air. It gets absorbed by the oxygen. There are some systems, like Verizon is currently using 30 gigahertz, but the coverage is extremely small. So when they said they put in 5G in Wuhan, for example, I don't know what that means. I don't know if that was, some people are using the same frequencies, like around 1 gigahertz or 2 gigahertz, which is kind of the current frequencies that are most commonly used. I don't know what frequency they were using, and I don't know how much of the city was covered. I would say that 5G is sort of a fill-in system, and it probably was like downtown pedestrian areas, shopping malls, things like that. So the old people, you know, who are dying of COVID are probably much less likely to be in those areas because they're less mobile than young people. And like, as in everywhere, this has been a disease of sick old people who in many cases are stuck in a home. They're either stuck at home, like in China, they're probably more likely stuck at home with their relatives, right? Mm-hmm. Sick old grandpa's in bed all the time and we look after him. Whereas in Western countries, he'd be in a nursing home. But in both cases, the exposure to 5G is probably much less likely for those people than say a healthy 20-year-old.
What about, though, the idea that, well, first you have the Internet of Things, and that's where 5G to me makes a lot of sense because they need to connect this matrix of new online, from your refrigerator to your toaster oven. And I guess the idea is that kind of everything becomes this like informational matrix, but also there's a lot of story about, hospitals having 5G, and you're correct. 5G is just nomenclature for the 5th generation of wireless. But the question is, what are these frequencies and what are they being implemented in terms of Wi-Fi, not just cellular phone, but and with like connecting all these different devices so that we're constantly being bombarded.
Well, I wouldn't be surprised if hospitals have more RF emissions from equipment right?
Yeah.
Every electrical cable produces, radio emissions.
Yep.
But it seems too early that there would be large 5G systems, because first they need to prove the technology in public spaces. And then people can say, put in an IoT system in their factory, right? Once you got a proven technology, a big warehouse or factory decides to put in a monitoring system. There may be some outdoor monitoring systems, right? Like if you have monitoring on electrical systems or telephone cables or something like that, there could be 5G systems, but this is all pretty early. So yeah, I'm just a bit skeptical that these low power levels, like for example, the average cell phone in an urban area transmits at 0.01 watts, whereas a microwave oven transmits similar frequencies at 600 to 1200 watts. So we have a massive difference. And we know that a microwave oven can injure you, right? If you were able to put your hand inside a microwave oven, you'd have probably fatal burns from it. So it really is the matter of the amount of energy, I think. And I haven't seen any analyses of what is the energy that people are receiving. There could be cases near a tower with a large number of transmitters where the level of energy is too high. I can't say that never happens.
Yeah, and they're talking about having these on people's homes. There's discussion about that in the United States already for these repeaters. And so, yeah, I mean, obviously it's how close you are. I think the phone's important because it's on most people all day long, where a microwave oven is much, we don't have one in our house for those purposes. But yeah, are you familiar with Arthur Furstenberg's book, Invisible Rainbow, and his worries about the satellites? So he was recently on a 5G summit, and he said we have 3 months left before we have catastrophic health impact because of all the low orbit satellites being put up by SpaceX and such. Have you looked into that at all?
No, I mean, I think the satellites are going to transmit at probably fairly high power, but by the time it gets to the Earth, the power level will be low. And the reason why cell phone systems or wireless systems keep power levels low is not for health reasons or anything like that, and not for energy conservation, although those are considerations, but it's to avoid interference. If the satellites were to transmit at a really high power level, then they would interfere with all terrestrial systems. So they have to be tuned such that when they hit the surface of the Earth, they're at a similar power level to a terrestrial system, which is around 0.01 watts. So I'm not sure. I mean, in the past, all these satellite systems have been commercial failures, and there's good reasons for that. There were a lot that were put up in the 1990s. Iridium, Globalstar, and they all went through several bankruptcies.
Yep.
Emerging as they sort of survived, but they'd been sold for $1 a couple times before they sort of achieved any commercial success. So you might be able to buy one of these systems in 5 years for $1. So
yeah, well, I hope
it's a huge discussion, and I don't want to get bogged down, and I'd like to move on to something. But in my clinical practice, we've absolutely identified those kind of electronic frequencies as impediments to health, and when we take measures to remove them and do other things, people do regain their health. So in my mind, there's no doubt that they do affect our bodies. And there also seems to be good evidence that a lot of these frequencies have been weaponized, by military for quite a number of years. And of course, that doesn't mean that everybody in the telecom industry is in on it, just like in the vaccine industry. But, I, for one, am not comfortable knowing that, there is technologies that could be modified in ways, the way the military, for instance, has done it, to affect populations or adversaries. So, but anyway, that's good. I really appreciate just your comments, especially since you are in the industry and you definitely know a lot more about those frequencies than I do. So here we are, we're a number of people that are out there just presenting information to people because we do understand we have problems. We do understand that the cure for, the most prominent problem we have now is worse than the problem itself. And even though all the flaws that, we're discussing here relative to, diagnostic techniques and so forth, the system or the powers that be will say, seem to be doubling down on our efforts and preparing us for phase 2. So other than, us just out there trying to, conclude some kind of truth out of this, what's our next step if these guys just keep doing stupid things?
Well, there are so many, I'm at the extreme end of the viewpoint saying that the coronavirus doesn't exist. There are many mainstream doctors and scientists who fully believe that coronavirus exists, that it can kill people, things like that. And they're still objecting to the lockdown. They're saying that the death rate is like 0.1%. There's lots of different calculations, much, much less than originally calculated because, at first they only tested seriously ill people. And so the death rate was high. If you test the general population, you find a huge number of asymptomatic cases. None of those die, certainly not of anything related to COVID. And so the fatality rate drops. Others believe that the only way to get herd immunity is to get young people circulating and infecting each other, getting immunity. And so then when they circulate with older people, they're not transmitting the virus. So you don't have to be a radical to say that this is an absolutely insane thing. And I think what we've seen with politicians is that they painted themselves in a corner. They decided to take these drastic measures, which not only destroyed the economy, but killed people through suicide and increase in the number of people dying from drug overdoses and alcoholism and domestic abuse, and people who needed to go to the hospital for something, who didn't, and who died waiting to go to the hospital. There's innumerable, reasons why people died. So the politicians have done this, but when was the last time you saw a politician come out and say, I'm really sorry that I destroyed the economy, that I killed more people than I saved, and we shouldn't have done it. Now, I think the Prime Minister of Norway did this, so kudos to him. But, they're still attacking Sweden, where there's really no difference between Sweden and other European countries. I mean, they're kind of in the middle in the terms of the death rate. The politicians cannot extricate themselves from this because they cannot admit that this was a problem. And my big concern is that there'll be another call for, a lockdown due to next year's flu or some other virus that they cock up. And the same politicians will say, well, we should do the same thing we did last time. It was so successful.
Yeah, we're in an existential crisis right now because of germ theory. It's like, what are we going to do? Once how it is when they set the bar, it's very few that we go back, very few times that we actually regress back to the way it was before.
Right.
And we're seeing the World Economic Forum now having talks about the new normal and pushing all this forward. And that's what I was mentioning earlier. It feels like germ theorists have really painted themselves in a corner. This whole concept of a new normal. Do you think humanity is going to go with this, going to restaurants with, I think it was James True said, the world is now a massive salad bar with plastic in front of everything.
Right.
It's like, are we just completely losing our humanity and our connection to nature here? We're really in an existential crisis. And I feel like we need people to wake up to the real science and start demanding that we have a common sense approach to these things. Otherwise, where is this going to lead to? It's going to lead to a complete disconnection from nature, ourselves, living in bubbles. It's really quite frightening.
A common response that I got from people was, after a bit of discussion, was, I'm going to trust the experts. And so our approach of science, the approach of the average person in the street to science is as a religion. If you have faith in your leaders, they're priests. They're not scientists. If you don't question what the scientific leaders are saying, you are not taking a scientific approach. If somebody says, I'm going to trust Tony Fauci, and I'm gonna believe what he says. I mean, of course, it's a bit difficult because he's contradicted himself so many times, but you pick what he said today and say, I'm gonna believe it because it's Tony Fauci. Then you're participating in a religion and not science. If it was science, you would challenge what Tony Fauci said, and you would never take anything for granted. And we've been trained that you can adopt scientific beliefs through faith. And that's essentially what people were taught in religions 200 years ago. You can get enlightenment through, listening to the words of a spiritual leader. And you can get some things from that, but you can't get the truth from that. You're just getting what your spiritual leader is telling you, and it may or may not be the truth.
So what we're looking at is they've perfected the science of ridicule because in my own experience, we encounter individuals that are more afraid of being ridiculed by their peers or the rest of society than they are of death itself. And of course, fear is a big tactic, but it seems like there's just such a need to conform, and such an even deeper fear that you'll be shunned by your peers if you don't say the right words, if you don't wear a mask, if you don't believe the narrative. So I think the scientific community has gone to great lengths to perfect social engineering, and I wish they'd put as much effort into real science.
Well, the masks are quite funny because there's as much evidence against them as for them. There's not really a lot of good evidence saying masks work. I mean, clearly they work in a surgery, right? If you've cut somebody open and you don't wear masks, you're probably going to infect them. That's a very special circumstance. We're talking about walking down the street. But I mean, I've seen many times people say, well, you should just wear a mask out of politeness, right? I'm wearing a mask and I'm trying to protect you, and you should wear a mask to protect me. But the thing is, if you choose to wear a mask and it's effective, you don't care what other people are doing because your mask is protecting you. Why would you want other people to wear a mask? You don't need it.
It's like the vaccine thing.
Yes.
Same thing.
Yes. It's just utterly ridiculous. You should have a choice. And if you choose not to wear a mask and you're wrong, you'll get infected and die of COVID. And that's your fault. But if you're right, then you're going to have a more pleasant life because you're not always going to be breathing, in the moist air or restricted air that you have with a mask on.
And of course, the average person is wearing a mask that does absolutely nothing. Even if you want to believe in the whole virus thing, they aren't wearing the proper type of protection. We used to say the same thing back in the AIDS days that, if you look at the pores, the micron size of pores in a condom compared to the size of,
the virus,
the alleged virus, it would be like putting a ping pong ball, out in the middle of the 50-yard line of the LA Coliseum or something in comparison. So just nothing adds up.
Yeah, it doesn't. The masks are a symbol. They're a symbolic, the symbolic that you're bowing down to the coronavirus god, and you're either doing it willingly because you're paranoid and you put the mask on because you really believe you're going to die, or you're doing it because you have to. Like I've had some health problems recently and I've been in the hospital and I have no choice. I can't go in without a mask. It's very uncomfortable and I don't like it, but it's like, I'm not putting the mask on because I'm respecting your God. I'm putting a mask on because I have to. If I want to fly, I probably have to wear a mask, under duress. Whether this will go on, because life with a mask on all the time is terribly uncomfortable. And, people who take their masks off, they breathe the fresh air and they have a much better life.
In the United States right now, at least where I am, it's like those, and I'm probably going to get some flack for this, but those wearing masks tend to be Democrats, and those not around here tend to be Republicans.
Well,
It's just kind of
it's
funny.
kind of interesting. Always thought of myself as a left-leaning person, and on health issues, conservatives are generally better. I mean, there's a lot of conservatives who are big into coronavirus, but there's more who question it. There's more who've refused to go along with it, and there's very few liberals who are questioning the viral paradigm, because they've been taught that Republicans are anti-science and we're pro-science, and what pro-science means is you take science on faith.
Yep.
And Republicans, they include people who don't believe in evolution and all kinds of other things, and they oppose abortion, and they come up with some erroneous ideas about abortion, and they promote those. So there's a little bit of evidence for that difference, but it's basically being Republicans who've been opposed to a minority, who've been opposed to vaccines, and definitely in this case they've shined in terms of opposing the impositions of the government, like the southern states like Texas and Georgia and Florida, that kind of broke the quarantine first, right? Everybody was supposed to be dying.
Yep. And they've got some big cities there that are actually have less their death rate and the overall, well, we know it's from the testing too, but infection rate is lower than like New York City and things like that. And if you just look at Los Angeles, because that's where I'm from, if we really had a pandemic, and you look at the way LA is, and with the homelessness and just all the issues they've had with other types of infections from homelessness and the population, and you're not seeing it there. You're not seeing the infection rate. You're not seeing the death rate there at all throughout this whole thing. And of course, they'll point to that it's the lockdown and it's what the governor's done. But if you actually look, people aren't paying attention. Like in Orange County, no one's really done anything. They've been all going to the beaches. They've been rallying about it, and they're not seeing what we saw in New York. So you raise anyone with common sense sees there's something up here politically.
Well, I mean, the Black Lives Matter demonstrations have not resulted in a surge in cases.
No, and I saw an interesting report saying, going back to the Spanish flu, about how they had these big rallies for World War I to raise money for bonds, and it led to the pandemic out of Philadelphia there. And people were up in arms now saying the same thing's going to happen from when they were doing it in Baltimore and Philly as well, and New York and all these places, but we're not seeing it. We're not seeing it right now. So it is interesting.
Yes.
Yeah. And in terms of the mask thing, you are right. It's like kind of, it'll be interesting study, David, is if somebody could actually start to correlate those not wearing masks with those wearing masks, because we're going to be able to probably do some of these studies if they continue this craziness and see what the health, who's healthier. Because we're going to have populations that are going to be basically buying into this and sending their kids with masks on and wearing the mask when they're out in public, versus those that refuse to. And it'll be a really interesting study. Maybe on the positive side, we'll be able to get some hard data to see really what the effect is of wearing a mask like this in regular life.
Yeah, and I think with children, the impact on socialization, a lot of people are concerned about trying to isolate children at play. I mean, children need to play together to learn how to deal with other people, right? I mean, children who grow up isolated are very selfish, can be abusive, things like that. This process of playing, of parents or teachers saying, no, you can't hit your friends, you need to go apologize, all that kind of stuff. That's how you learn how to be a decent human being. And it's how you learn, if I want to win the game, I have to work with the kids on my team, right? So there's lots of lessons that you get from that kind of socialization. And this idea that we can put each child into a separate bubble and to protect them from this virus that hasn't killed any children, and not have to worry about their socialization. I mean, what is this going to do to the rate of suicide and drug abuse to these kids when they get to the age of 14 or 16?
It's insanity.
Well, if you step back from the CV-19 and just look at everything that's been going on probably for about the last 5 decades that I've observed, everything without exception is doing the same exact thing that the COVID-19 is doing now. It's causing division, opposition, paranoia, and just setting up opposing camps. So I don't know if it's just coincidence that this is doing the same thing, but it seems to be part of the same old psyop.
Yes.
Yeah, and so we're coming up on time here. A couple of minutes left. David, anything else that you would like to address with our community and on the show that is concerning to you, or in terms of maybe a solution to where we can go, or what your plans are moving forward?
Well, I've been hit with a pretty big diagnosis, and so I've kind of stopped my coronavirus research just because I don't have the time or energy. Um, According to the mainstream, I have terminal cancer, but I want to get through it, and it's becoming easier for me because the mainstream oncologists really have nothing to offer me. They can give some palliative chemo, so I'm looking at a lot of alternatives, but this is taking all my time, and I have less energy. My energy has declined quite a bit. So I'm still doing little bits and pieces of research, and I might update some of my documents, but unfortunately I don't have the energy to go forward. And I'm kind of thinking that I was getting close to the end of this. Like I've gone down all the different dark alleys, and I've gone down the antibody testing, the other reasons for death, the PCR testing. I've investigated just about everything except the vaccines, which a lot of other people are doing really good work on. So I'll continue to discuss it with people, but not add too much. But just look at the science, right? You critically, that's all you need to do, and read a variety of opinions. And I think people listening to your show, they're not trusting Tony Fauci and all of these other people. And there's huge financial conflicts of interest. Like, why is Tony Fauci promoting remdesivir, which is produced by a very politically connected U.S. drug company, Gilead? Right? Is there some kind of benefit for Tony Fauci there? And why I'm not really a fan of hydroxychloroquine, but why are all the mainstream slamming it? There's things are being guided by commercial interests, and
very much so.
Yeah, they want to delay the end of the lockdown until there's a vaccine, which I don't think they're going to get. But the more they delay it, the more damage there is.
They're painting themselves in a corner right now.
Mm-hmm.
It's forcing an awakening. And I'm so sorry to hear about your diagnosis, and that's a massive rabbit hole that we cover, and Dr. Lando has decades of experience in that arena. I don't know if Barry, you want to do a quick spiel on that. I know we're kind of running out of time here, and maybe
I can go another 5 or 10 minutes.
Okay, Bear, all you, man. 5-10 minutes. Cancer.
Yeah,
go.
Like you said, it's in 30 seconds or less. Yeah, it's a massive topic, and one thing I can share, though, which would be more than hopeful, is that and again, this is you have a belief system that's been borne out through clinical medicine for 40 years. So it's not just a theory or something I read or a belief system. It's actually, observable evidence. And that is just like the germ theory, the cancer theory is also extremely flawed. And cancer can become very problematic. But there was a time when people's bodies weren't inundated the way they are these days with so many things affecting us from so many levels, that cancers would fulfill a biological purpose, go full circle, And we've got it down to a science where we understand the different phases that a so-called cancer, which is a purposeful biological expression, the way we understand it. We know exactly what microbes are involved, in the whole process to expedite the process and make sure it goes full circle without a problem. We know what kind of resources are necessary at different stages. And so when in my clinical medicine, I never asked to be in that situation, but for whatever reason and the type of work I was doing and what I learned, I saw mostly nothing but cancer. And the folks that did not do the conventional treatment will say, um, it wasn't just a high survival rate, but it was just an expectation that we could guide the purposeful expression that the body was, undertaking for other issues that would take way too long to get into right now. And, again, we just had an expectation that it would go full circle and people would be fine. Just like with the COVID-19 situation, part of the whole thing is we have a belief system that's been fostered by the conventional system that somehow this is deadly and we're just expect big problems if you've been diagnosed with COVID-19. And we find, well, it's not necessarily true. And also there's a whole different story, about microbes that people would be just startled to hear if they could really wrap their minds around the truth. It's the same thing with cancer. And again, back in my clinical years, when people would come in with the diagnosis, the biggest problem we had was helping get people through the diagnostic shock and then going through an educational process where they would then be able to understand what was really going on and then go through the process, and also expect that there are certain times during the process, for good reason, that your body wants you to rest. It wants you, there's two different phases. One's a kind of a sympathetic response phase, and the other is the other side where you're actually in the healing phase. And most people that are diagnosed are actually already in the healing phase, but that's typically when certain symptoms come to play, or you start feeling a little washed out or start losing some weight and that kind of thing. And, then it suspiciously, feels like, oh, I really am sick. So I'm not at all suggesting that, it's not a situation that you don't take seriously. You do want to treat it aggressively, but you want to know how to aggressively work with the body and not impede what it's trying to do in the first place. So again, I'll just summarize because I could go on quite a while in a lot of different directions and things that we would be able to do to assist the body to make sure it didn't get caught on an uncomfortable plateau that could be dangerous. But my experience is that it's not at all a diagnosis or a prognosis that should even keep us up at night if we understood what was really going on.
One little bit of black humor, the oncologist made it very easy for me to refuse chemotherapy. I mean, I wanted to go listen. I've listened to a variety of different doctors and healers. So the basic treatment he proposed was this pill, which is known as 5-FU, which apparently oncologists humorously define the acronym as 5 feet under. And it was developed the same year I was born, in 1956. It was patented. So they're giving me this ancient drug that has known, or they want to give me this ancient drug with known toxic side effects. And I said, if I take it, how long do I have? And he said 2 to 3 years, and less if you don't take it. But, I don't believe there's any scientific evidence for that. So because they're not promising me that, I can live the rest of my life, why would I even consider this? If I was scared and without other resources, then I might do it. But I think in a year, I would be, a cancer patient with my hair falling out and bent over, walking with a stick, all that kind of stuff. I'm not going there. And even if it doesn't pan out for me, I figure with the alternative treatments, at least I will have, much better quality of life for whatever time I have, and we never know how much time we have.
Yeah. I don't know what the numbers are at present time, but back when I was in the thick of things about 20 years ago, there were some numbers available that suggested that if you didn't do any treatment at all, that doesn't mean you don't change your diet, you don't, see an alternative practitioner, you just do nothing. The survival rate was up about 40-50% compared to people that sought conventional treatment.
Mm-hmm.
So my advice to people over the years, not giving anybody advice now, but I'd say you're way better off if you just do nothing.
Mm-hmm. Mm-hmm. Yeah, I think I have to do something, but I'm going to listen to the mainstream, because there are some treatments that can help. Even some alternative people have told me that they can. So I'm not going to, completely go one side or the other. But I'm very, very skeptical. And the more systemic, aggressive treatments are just have a horrible record. So I'm not going to go there.
So the only final comment I'll say is, I just, hey, we're pulling for you. We're wishing the best, and that you can expeditiously get through this.
I want to come back for the next outbreak. I want to be pain. I want to be pain in the ass when Bill Gates declares the next pandemic.
Yeah, but one thing I'm 100% sure on is your body and everybody's body knows exactly what to do, and the more trust we have in that process and in the biological process that we diagnose as disease, then mankind will make great leaps forward in not just our biological health, but in our consciousness as well.
Thank you. I do have to go now.
Okay.
But it's been a wonderful conversation, and great talking to both of you.
Yes, David, thanks so much for joining us. Everybody, thanks for listening. If you enjoyed this talk, please go to alphavedic.com. You can join our mailing list there, get all our information, join us on Telegram, t.me/alphavedic. Thanks, guys. Have a wonderful, blessed day. Get outside and grow something. Get your hands dirty. Cheers.